Happy Nurse Appreciation Week! Do you guys appreciate me?
I'll take care of you.
I'm really proud of the fact that I am a nurse. And when people ask me what my profession is and I say that I'm a nurse, most of them are really impressed. Many of them tell me about nurses that they've known that have taken care of a family member and that I must be a very special person because I am a nurse. And the majority of patients that I've taken care of over the last 7 years, the majority of them have been very thankful for the care that they've received from me. I'm really glad I chose this profession because it's very rewarding and fulfilling. However, there have been a handful of patients over the last 7 years that really don't get what my job entails. There are the patients that they consult WebMD and then say that I don't know what I'm doing because the internet says that this is how I should be taking care of them. What? There are the patients that say I'd rather just wait for the doctor because he knows what he's doing. Oh no! I've had some patients that say, all you do is sit around at a computer all day. What's so hard? What? This happened to me most recently a few months ago in the operating room. The CRNA and I were taking a patient by stretcher to the room, and they turned to me and said, "So what's your deal?" Huh? I mean, I get what she does. She's giving me all the medications, but are you just sitting in the room? Are you just an extra person? Initially, I got really defensive and I was trying to come up with a way to explain my job to them, but then I realized there just wasn't enough time to explain all the things that I do in my job, and they probably would have been bored and wouldn't even listen to me. Honestly, I'm sure the patient didn't mean anything by it. I just blamed the Versed. And even though it might seem thoughtless, it's a good question. Why are nurses important? As I was growing up, one of the main things that kept on coming up is that I wanted to be a doctor when I grew up. But there was a sudden shift in my thinking in high school. I decided to be a nurse, and the main reason for that was that I wanted to have direct patient care. There are wonderful doctors out there that are caring and compassionate, but let's be honest, they have a larger patient population that they're dealing with. They don't have the time to spend on each individual person. And even though nursing ratios are out of control, and that is a problem, that's another video, but doctors simply aren't able to have the individual patient care that a nurse can. Most nurses in school are taught to have holistic care, which is not only just focusing on physical healing, but the emotional healing, the mental healing, the spiritual healing of a patient. Nurses get to know their patients really, really well, especially if they have chronic illnesses in our back over and over and over again. And because there's that continuity of care where we're with the same patients over and over again for long periods of time, nurses pick up on things that many other medical professionals wouldn't even notice. One of my proudest moments as a nurse was when I worked midnight shift on a med-surg floor. I realized that my patient with appendicitis could not wait for his scheduled surgery in the morning because his appendix was about to rupture. Nurses are the main communication hub among all the other departments. One of the main things that I do over and over again in my day is I gather information, I synthesize it and analyze it, come to conclusions from it, and then I relay that information to the people that need to know that information. It's all well and good to do a bunch of tests, but if nobody is passing along that information and communicating it clearly, then it goes nowhere. In a typical shift, a nurse might talk to the physician and radiology and lab and dietary and physical therapy and case management and pharmacy, coordinating all those discussions and all those departments and all those teams to benefit the patient. Nurses are important because they advocate for patients. They say no, or wait, or let's think about this, when the patient can't, or the patient doesn't know that they should. I know this from experience. It's difficult and kind of scary to stand up to a doctor, especially one that's much more experienced and educated than you. But I've had to do it, and it's all because the patient comes first. I could go through a typical nurse's shift and list off to you all the tasks and responsibilities that she or he does, but these are everyday things that we don't brag about because they're not glamorous, they're boring. More often than not, there are things that nurses are doing behind the scenes that patients aren't even aware of. But nurses do a lot of little things that add up to a big difference in a patient's care. So the way I see it, nurses aren't just important to healthcare, they're vital to it. whether in a hospital or home health care, whether in the delivery room or the nursing home. Nurses make a difference because they care. So to my fellow nurses, happy Nurse Appreciation Week. And if you know a nurse, show them how much you care. I'm the Musical Nurse. I'll see you guys real soon. Bye!